And one of the ways I know it's prominent, it's going on, mainstream kind of networks. And one of those networks that I know about is Dave Asprey's podcast, which I saw you talking about Ozone on, and was very happy to see that. And I know you use a machine, the EBO2, correct?
Yeah, I don't have one in my office yet, but I refer to a dear friend in LA. And it's one of the, I think it's one of the most exciting therapies I think that we have right now to address all of, what I call the modern terrain, right? Like what, we say Lyme, we say all these things, which of course are very much part of the story, but, it's in the backdrop of, all of the things that, we're up against, from interference fields and toxicants and, disrupted circadian biology and, imbalances in our microbiomes and ecosystem and trauma, all of that, right? That's all what we're treating, right? And so, I got EBO2. I like to, experiment on myself, as, many of us do. And so I went to my friend's office earlier this year, and it's a very elegant treatment in that it takes your blood, it goes through a filter, and there needs to be more research, but what we're assuming and we know that the filter basically filters out beta 2 microglobulin, which is an inflammatory protein, also different inflammatory compounds, heavy metals and mycotoxins, and other, probably like microplastics and probably spike protein, who knows, things are, of that nature. Then it ozonates the blood. And then combining biophysics, the blood comes back to your body going through what we call a photonic sleeve, which is red light and or UV light. So, we do that in different ways, but it's, part of the treatment. So it's, I think a really, again, elegant treatment for accelerating detoxification and kind of offloading inflammation in the body and, some of the probably like biotoxin, mycotoxin related things. In Europe, they have a stronger filtration device. I'm have some referrals in Switzerland in this clinic called Alpstein, and they have this device called ionospheresis that came out of the Ionis Center out of Germany. Dr. Straub invented this. He's a nephrologist and toxicologist to basically develop this system that is, again, a blood filtration, but it's going to be stronger. They use these specific filters from Japan that are filtering very specifically, heavy metals, pesticides, what gets extracted out of the blood they measure, and it's called an LUOT. And there's this IGL Labs. I have one patient in particular who recently did this, who's over in Switzerland, and he showed the before and afters, and it's incredible what comes out of the blood, and how good he's feeling after this treatment. So, I think again, our biophysics and the things, the energy medicine. And then, I think in every clinic that we need some blood filtration, equipment, given, that, we're, basically overwhelmed with toxicants from preconception at this time.
Totally. And, the way I saw it, we just purchased the unit and we're waiting its delivery. Yeah. So I was excited about, because we've been doing major autohemotherapy and then rectal insufflation, ozone, right? UVB, all the oxidative therapies are wonderful. It's just, how could you actually keep advancing it a little bit?
Next step, we and ozone and 10 pass. And so this though is, definitely, and again, everyone's going to need different things at different times. It's a really great tool to integrate into the, the clinical model. So no, I'm so glad that you're gonna, have that. So you'll be excited to see what happens, right?
Absolutely. Absolutely. Anything to progress results. And again, everything's personalized, but the idea, it's a natural approach, right? And that filtration is basically like helping your liver out. Livers are already overtaxed. All our organs of elimination are completely taxed. As you mentioned, so many toxins out there constantly. Even if you're, trying to be as healthy as possible, you're just exposed. It's in the air. It's in, all materials we wear, like no matter what. So I think it's a wonderful, especially if you're ill, it's a wonderful addition to add that blood filtration, ozonate the blood, have that antimicrobial effect that we so many need, because we all have different microbes in us and pathogens. So yeah, I'm excited to see that.